Hi, welcome back. Now we're going to talk a little bit about chelation, what it is, how it's used, and what it does. Doc, can you enlighten us on chelation, please?
Okay. I call the kind of chelation that I do as cardiovascular chelation.
Okay.
It is not the ordinary chelation or the usual chelation that is being heard. I made quite a lot of modification with regards to this, especially to suit the Asian patients.
Okay.
But we can adjust it even for Caucasians. Now, this is a procedure that is a surrogate or a substitute or alternative to bypass surgery and angioplasty, which are invasive. This one is non-invasive. And I would say that chelation is a scientific, effective, legal method of removing or declogging the arteries that had been blocked by atherothrombosis, which I mentioned a while ago, that it is the hardening and narrowing and swelling of the arteries, which include, of course, the roughening of the inner portion of the arteries. Now, this is done by infusing a kind of mixture, the basic of which is EDTA, which can clot or can combine molecularly with the plaque, the hardened portion of the artery, and then it goes together in the circulation and is excreted out of the kidney. The scientific basis of this is very good because, you know, the thing that we remove from the plaque could be excreted or could be measured in the urine. No, we can show this. No. Okay. Now, chelation therapy is being done by people, preferably internists and cardiologists, that have special training in this kind of a procedure. No. Okay. Normally, it takes about 1.5 hours, as per modified by my clinic. But then in Germany and in the United States, it takes about 4 hours. 4 hours. No. In the process, the patient will not feel any dizziness, headache, weakness, or anything. Actually, they will not have any side effects, except when you place the small needle. We are using pediatrics needle to infuse the solution for 1.5 hours. That is the only thing that the patient may complain of. No.
So this is done as a drip?
It is done as a drip for 1.5 hours. No. Okay. And as I said, even after the procedure, if they are driving, going back to the office, they can drive. There will be no precaution. And this is very, very safe, believe me. For the past 25 years that I have been doing this, I have not seen a single death directly related to cardiovascular chelation. Unlike, of course, the invasive procedure, which has certain, which I wouldn't touch, percentage of death. Okay. As I said, I had been doing this procedure the past 25 years. And just by common sense, we will not exist this long treating patients if it has side effect. In fact, it has side benefits, no, rather than having side effect. No. Just to mention in passing that there are a lot of side benefits. Number one is it will increase the immune system of the patient. Okay. In other words, they will have resistance against frequent bacterial infection, viral infection, and even what we call the fungal infection. It increases your cognitive function, your ability to think. In fact, this could be used to treat Alzheimer's disease, those who are Alzheimer's disease. For the simple reason, I will not wait for a while to explain this. You know, patients with Alzheimer's disease have been found to have a lot of aluminum deposit in the brain and mercury in the brain. These substances or these minerals are being removed by chelation. Now, it of course increase our gonadal function, our gonads. No, in other words, those whose sexual performance are already diminishing, it could improve. Okay. Now, chelation also could prevent cancer, believe me. There's a study in the United States in one township, and they found out that with only 20 chelation, using the general population as the control, they chelated about 100 people. No, using the general population as the control, they have the same lifestyle. They eat more or less the same kind of food, and their exposure to pollution is about the same because they live by the highway. No. Now, those who had been chelated 20 times, the 100 of them, after 18 years has been found to have less incidence, as much as 90% less incidence of cancer. So this is, because it is common sense. When you remove the toxic minerals and the toxic chemicals in the body as being done by chelation, naturally, those causes will disappear. And
well, that's an interesting point. I read up a little bit on chelation, and I saw that it started out as a way of removing heavy metals from the body that were poisoning the body. So how did that move from removing heavy metals to the treatment of cardiovascular problems?
During the early times of chelation, one thing that they noticed, whenever they do ejection of metals, we call it, via the urine, and of course some in the liver, they found out that the complexion of the people or the person is getting better. It's pinkish. If you are fair, they become pink. And they determined it, and they found out that it's because the arteries are flowing very well. There is a good blood flow in the circulation. So since then, scientists determined why this is so. And they found out that the effect of EDTA is to claw. It's like the pinch of the crab.
Right.
They claw the molecules of the plaque, especially the calcium molecule, the aluminum molecules, and then it goes together in the blood, and then it's thrown out in the kidney. The kidney gets the substances that be thrown from the blood. So we can measure these things that is thrown out. And so that's the reason why it softens the arteries again. And as I told you, we have an instrument that could determine this. Before we do chelation, we can determine how hard it is. And then at the end of chelation, say the session of about 30, the usual session is 30, I will be able to demonstrate to the patient that the artery is already soft and flexible.
So this is an actual measurement, a physical measurement that you can show that the arteries have gotten more elastic? Or?
Yes, it's a computer measurement. It's a computer measurement. For example, I'll give you an idea. The normal flexibility or softness of the artery is something like 0 to 70. Okay. 70 to about 300 is hard. More than 300, it is very, very hard. I get patients with 350, 400 in the beginning. But at the end of the 30th session, it will be within the 0 to 70 level. And of course, the patient feels the difference. But that is subjective. It is not saleable among doctors if it is subjective. Because what the doctor wants is something that is measurable. And this apparatus could measure it.
Does this therapy, does it have to continue for the rest of the patient's life, or is it just over a certain period that you do it, or how does that work?
At the end of the prescribed number of sessions, I request the patient to come every 3 to 4 months for one session. Okay. The reason for which is, it is my opportunity to evaluate if they are following the lifestyle that I have advised them. Number 2, there are factors in the environment that is beyond the control of the patient. They will imbibe it. For example, lead. in busy streets of Manila. You know, you can inhale it, you can ingest it. It could be absorbed in the skin. No, it could be absorbed in the skin. That's why, you know, I advise those who are coloring their hairs using lead-based coloring. They should avoid that because that could be absorbed in the scalp. And of course, sometimes the paints. These are lead-based. You think it is something white dust only, but actually those are paint dust. And it could drop in your coffee, in your food, and you'll have the lead in your... Now, these are the things that we want to remove so that there will be no recurrence of arteriosclerosis. No.
In addition to the therapy that you said, what, 30 sessions or something is a normal session, what sort of lifestyle changes do you recommend to your patients?
Okay.
I mean, or is it just the therapy, or do you have lifestyle changes as well?
Yes,
or?
very important, the lifestyle change. Number one is we teach them the right or proper foods.
Okay.
No. And I will talk about it. They have to have the right exercise program. No. And they have to have the right nutrients. It's higher, we call it nutraceutical, which is higher in level than simply supplements.
Okay.
No? Okay. Since we know that there's a lot of things that are ingested whenever we eat that can cause arteriosclerosis, we teach them, of course, to avoid processed foods because we said there are a lot of chemicals there and it is very salty. They should take vegetables that are organic, no, not with pesticides, etc. Now, they should take food that are fresh, no, because stored foods, refrigerated foods for many days has no more nutrients, no. Okay. They should avoid commercially produced meat because, say, these animals are being injected chemicals and fattening substances like estrogen. They call it diethylstilbestrol. Now, if injected, it will cause fattening. Their weight will increase so that you'll be earning more money. No? But the problem is, this estrogen or DES, which is part of the birth control pills, may cause cancer, may cause arteriosclerosis and all of this. Very commonly, cancer of the breast and cancer of the prostate. No? So we teach them to avoid this. No? And of course, a lot of other things like they should avoid hydrogenated fat. Hydrogenated fat means liquid fats, whether it's from vegetable, that has been bombarded by hydrogen to make it semi-solid, like margarine. Anyway, margarine is generic. We are not mentioning any. This is very bad. This can cause arteriosclerosis, and this is not recognized by the body. It's like a foreign substance. Now, the other thing is, in the use of oil, selecting oil. Believe me, coconut oil is the #1 oil in the world.
It's the best? Or
it is the best.
It's the best, okay.
Although in the past, because perhaps economic computation, they have quite spewed out a lot of criticism on, but this is the best because coconut oil is heat resistant. You can use it 5 to 6 times in cooking for as long as it does not have the taste of, say, the fish. No? Okay. It contains lauric acid. That's the only oil that contains lauric acid. Lauric acid or laurine is a substance which is equivalent to the colostrum of the mother, the first milk of the mother that gives immunity to the child. And coconut has that. Really? So it increases your immunity. No? So I always say, take coconut oil for cooking. No? Now, polyunsaturated oil like olive oil, soya oil, sunflower oil, all of this. This is very good because the body does not produce their kind of oil. But use it once only if you will use it for frying. But take it more with salad. It's very important because it is called essential fatty acid. It is not produced by the body. And it is very good for the health of the arteries, of the heart, of the brain, etc. So, that is one. And then number two, the only reason why I said we should avoid fast food is because they are using the oil repeatedly the whole day. Here is a strainer, say the French fries there, place it there and cook. Then afterwards, another one the whole day. When in fact, if it is coconut oil, they use it only for about 7 days. So I advise them, not criticizing them, if possible, even if it will be more expensive maybe on their part. Don't use too much